bring in Dr. Aslam Dasoo, convener of the Progressive Health Forum. Dr. Dasoo, thank you so much for joining us. We're going to speak about a number of health issues, but just having listened to that piece on what's going on in Eastern Cape hospitals, where the Eastern Cape health officials are saying we don't have a food problem, but Gift of the Givers is clearly rolling out food to these hospitals. Do you have a view on what you think is going on here?
Yes, I think it's emblematic of a deeper dysfunction in the health system overall. Eastern Cape, of course, has been kind of a poster child for this dysfunction. Of course, the issue of running out of food, takes it to a new low. And it's really of great concern, especially in the midst of the pandemic. And one would have expected that would not be an issue given the amount of resources that have been pushed into that province following the onset of the pandemic. The Gift of the Givers have been doing this, helping out the Department of Health in various provinces. Recently, of course, our teaching hospitals in Johannesburg had no water, and neither the Department of Infrastructure or the Department of Health could do anything about it because they had no money. And they had no management of this, and these people had to step in. It's an indictment on provincial management of health, and at some point there's going to have to be a reckoning for this.
Is it a lie though? Because you've got Gift of the Givers and clear signs that food is going to these hospitals, and then you've got health officials saying no, we don't actually need the food. Are they lying? I mean, sure, I can't imagine that someone would lie so blatantly.
Sure, I think it's pretty obvious what is happening, and I think the response from the government may be a defensive one. I wouldn't call it lying, but if it's an untruth, it's an untruth, and there's just nothing one can do about that. The fact of the matter is that I seriously doubt whether the Gift of the Givers has an incentive to speak the untruth here, and there has been collateral information, not just from the Gift of the Givers, that this is actually indeed happening. So I'd leave it then to you and your viewers to decide the veracity of this report. But I know that patients are in trouble as far as this is concerned.
Yeah, and we'll await more details. Tomorrow there's going to be a media briefing from the Eastern Cape. Let's move on to other health matters. Yesterday in the Sunday Times, a very worrying report. Obviously for the scientists concerned, a number of scientists were named, but two names we know extremely well, Glenn de Grey and Professor Tulio de Oliveira, apparently have been receiving a lot of flack on social media for the science that they're sharing around COVID-19, even receiving death threats, some of them. I mean, it's absolutely extraordinary that this can be happening. What do you make of this social media backlash? Do you think it's just driven by a few extremist people, perhaps who do not even want to believe the science?
Look, attacks on scientists is a global phenomenon, especially in times of calamity. And we have this pandemic right now, and you have seen the amount of conspiracists and religious extremists and all manner of people, anti-vaxxers and others, coming out and, railing against the scientists, finding them soft targets. And we see this repeatedly. We had it, you see it in the abortion conflict. We had it during the HIV/AIDS issue. And of course, scientists are they're pretty exposed and they are easy targets. I must put it on record that we as a Progressive Health Forum, we utterly condemn this behavior, and it's an indictment on those who would even dare to do this to very ethical scientists working very hard for the common good, not just in South Africa but globally. Now, as far as this particular threat is concerned, it does have some elements that are quite questionable. For example, it's addressed to the president, but it targets 4 or 5 well-known scientists, and it leaves other very well-known scientists out, especially those who have been, very much in the limelight. And it seems to be less directed, and I say this with circumspection, it seems to be less directed at the scientists themselves than at how the intimidation of them will result in a great embarrassment for the government. If these scientists are intimidated to the extent that they can't perform their functions, our response to COVID is compromised. And that reflects on the state. Now we have a situation in our country, and no one is blind to it, that there's and we saw it during the July riots, that there is an element of an insurgency underway in various things happening. This may well be just one more facet of that. Certainly the scientists are very worried, and they have taken the necessary measures, because we don't have a security system in the country that can immediately sequester them, ensure their safety. But they have taken measures, and one hopes that this doesn't escalate. But it does seem, given the construct of the emails that were sent to them, that this is a highly uninformed group, but who have latched onto the scientists as a battering ram against the president and his government in the time of COVID, which is actually an insult to us, all of us, and an attack on all of us, if you really think about it. And that is why it must be condemned, and it must be dealt with firmly, so that we don't have this anymore.
Absolutely. I want to move on to the PCR pricing issue. We heard over the weekend that the Competition Commission has reached an agreement. This is on private sector prices for these PCR tests, to bring them down from over 800 Rand to about 500 Rand, which of course is great news, because I'm sure that cost is pushed onto the private medical consumer. But do you think it's enough? I mean, do you think it's enough that there's just a deal and the different laboratories are agreeing to charge less? What about the enormous profits they've made so far?
Sally, there is a context to this, okay? So at the outset, when the tests were in short supply, reagents were in short supply, etc., and there was a huge demand, prices went up. But as soon as it became a prescribed minimum benefit for insured people, this is mainly in the medical scheme environment, then a price was set. And this was in keeping with the usual tariff setting that medical schemes and service providers undertake. But obviously, the rapid increase in supply, together with the existing demand during the waves, not only brought input prices down, but also created such a high volume through these labs that I think an amount of 10 billion Rand was put forward as their income just from testing. Now, this decrease in the input cost is not passed on to medical schemes, and members of medical schemes will pay for this in increased premiums. Those who pay out of pocket, of course, will be relieved that 850 Rand has now moved to 500 Rand, but it's still a huge amount. However, one must be clear that this is particularly a middle-class issue. Members of medical schemes and people who can afford to pay this. The state does these tests free of charge. And everyone, you, I, anyone else can go to a state facility and get the test done. So we are dealing here with a system of private health care that does profit, and it legitimately profits. But the Health Market Inquiry made the point that it has such market concentration that it acts as a monopoly, and monopolies, we know, drive up prices. So you've got 2 or 3 large labs, you've got 3 large hospital groups, and we understand and we all know the cost of these facilities. So this is perhaps a signal. And it couldn't come at a better time, because the pandemic allows for opportunities to do things better and differently. And perhaps the private sector needs to look at itself here and say it made an arrangement with the Competition Commission on this issue quite easily. If it examines how its price points are placed in front of the country and what the affordability issues are, it may stop a very heavy hand of regulation that may well be justified in future and would damage these businesses. So, it's in their interest
Yeah,
to think twice about it.
Yeah, you make a really interesting point. I mean, no one likes to be ripped off, whether you're middle class or rich or on the poverty line. No one likes it, and it's not fair. But you make a really good point that perhaps this is a good time to signal a new way of doing things. Do you think the PCR prices should come down further and are likely to?
Yes, I think so. Look, at the moment, these private labs do have a number of input costs. They have staff, equipment, etc., that they have to price in. And I think all of that comes to, 350, perhaps 400 Rand at today's prices. So the profit margin of 100 Rand is not outrageous. It's more in keeping with what you would pay for food and for other amenities of life. And I think that's fine as it stands. But if we find that input costs drop, cost of reagents drop, cost of the testing kits drop, then those savings must be passed on to consumers, whether they're medical scheme members or ordinary people, and in the street without insurance. And so I think it's a signal, and I'm very pleased that it has happened. And I'm also pleased that it wasn't too much of how shall I put it, a legal process, which, the Competition Commission acts and then it goes to the tribunal, and that would have been a long, drawn-out process. I think the labs understood that they can't be charging this. As you said, no one likes to be ripped off. And at 850, it was a rip-off. Let's just accept that and move on from that, but not to forget the lesson that this provides us.
Thank you so much for chatting to us this evening, Dr. Aslam Dasoo, convener of the Progressive Health Forum.